There's bhang, there's hash oil, there's charas, and then there's ganja. So first of all, how do you subjectively feel when you've had cannabis? The world seems to slow down. This is called the temporal slowing, which means everything seems to be just going on in a very slow motion, whereas your thoughts are going really super fast. You may also feel subjectively very hungry, and these are called the munchies that you're having for particularly fatty food like a pizza or a burger or just french fries and soda. You also feel a sense of a general high or disinhibition, which means sometimes you may do things which are very out of character. But beware, beyond the nice trip, there's something called a bad trip that you can get on cannabis. There have been individuals who, after their first exposure or even after their 10th exposure to cannabis, have reported psychosis, having hallucinations, feeling paranoid, hearing voices and seeing and doing things that aren't real. So users of cannabis interestingly don't have a very clear-cut withdrawal. However, subjectively, you may feel sluggish, you may feel extremely bored, you may not want to get out of the bed, you may have amotivation for days, not wanting to even brush your teeth at end, and finally, you may eventually, when the cannabis leaves your system, start to feel more like yourself. There can also be depression in long term, very common. There could be a rebound anxiety, extremely common after cannabis withdrawal. And of course, your cardiopulmonary status does get affected because most people who do cannabis smoke it either in a bong, in a joint, and with that hit, there is some amount of chemical residue that goes into their lungs. Opioids are popularly used in pain management by doctors. However, there are also variants like heroine, popularly known as smack, very popular in the movie Padta, Punjab, which brought to light that there's a rampant use, especially amongst the youth. What do opioids do? They're slightly different than the other drugs because they're downers. They make you feel a little dull sense of being. Some people enjoy it because they want to cut out the reality. They become lethargic, they're sleeping most of the time, so it's called nodding off. Particularly over a long period of time, you definitely age faster. The sense of you changes. The opioid users, which are chronic users, seem to look a lot different what they are supposed to at the right age. In fact, their cognitive capacity decreases, their productivity decreases. Even in some studies, they say that their sperm count decreases as well. So it can affect all parts of your body, including your blood vessels, your livers, your eyes, your ENT system because your nose gets impacted. So practically every part of the body can get affected because of the opioid use. It is the opioid withdrawal which is extremely scary to look at, especially for a loved one. If a loved one of yours has been using opioid for a while and obviously has tried to quit on their own, they may have some of these withdrawal symptoms. Number one, we notice a lot of lacrimation or watering from the eyes. There's also a running nose that we particularly find in opioid users when they try to quit suddenly. Abdominal cramps, which can make you feel like it's the death of the world.